If you've been to 17 doctors and you have complex chronic mystery illness and no one has done a clustered symptoms and a visual contrast sensitivity on you for $20 plus about 7 to 15 minutes of provider time, you can get to a 95 to 98.85% sensitivity, a 1 to 20 to 1 in 50 chance we're wrong that you're not CIRS. And that also makes you feel confident I should unlock spending my money on the Shoemaker Confirmatory blood draw labs.
Welcome to Golden Girl, a space where we dive deep into health, healing, connection, and community. I'm your host, Becca Golden, and this podcast is all about sharing and documenting my journey. Each episode, we'll discuss topics like health and wellness, what I'm learning in therapy, work-life balance, relationships, community, and all the ways I strive for more aliveness and presence every day. Let's dive in. Hi, everyone. Welcome back to another episode of Golden Girl. Today, I am sitting in Dr. Eric Dorninger's podcast studio in Colorado. I'm so happy to be here, and I'm really excited for today's podcast episode. Today, we're talking all about CIRS, Chronic Inflammatory Response Syndrome. CIRS is something that I likely have, and I really only just found out about it pretty recently. So my goal with today's episode is to help bring more awareness to CIRS and help educate you guys on what it is and hopefully answer some of your questions. So Dr. D, thank you so much for being on the podcast. Before we dive in, can you just introduce yourself and tell us how you got started in this work?
Yeah, thank you for coming to Colorado on a snowy May day. Mm-hmm. So for those of you who don't know, we got 6 inches of snow out here. But I'm Dr. Eric Dorninger, and I'm a doctor of chronic complex mystery illness. And I got my start in healthcare on the ambulance as an EMT and volunteering with hospice. So my bad joke is I would help people die with dignity during the day and then try and make sure no one died during the night on the ambulance. And what I learned riding on the ambulance is the job of the ER is to make sure we don't die today. And they kick butt at that. They're extraordinary at that, and that's good, heroic, conventional medicine. But then they discharge you back to your chronic illness. And sometimes it's like you broke a bone, and that's perfect. Other times you're in there for the 4th round of palpitations and arrhythmias, and they say your EKG is showing a little bit of tachycardia or nothing. Don't let the door hit you in the butt on the way out. And the patient goes, okay, I'm not dying, but my quality of life is horrible. And I just don't even know if I want to live anymore. I'm exhausted every day. If this is it, I just don't see what the next 30, 40, 50, 60 years looks like. And I wanted to help pick up those patients. So I was on the border between becoming an emergency room doc, because I think that's just great medicine. And I love treating the underlying cause to stabilize a patient from dying. But then I had my own healthcare experiences, multiple, and I was talking about a vision I had for healthcare, which was really getting to the why of your headache or the why of your skin rash. And a platonic girlfriend of mine said, yeah, that's naturopathic medicine. There's a school for that in Seattle and Oregon and Arizona, which is Bastyr University, National University of Naturopathic Medicine, and Sonoran University in Arizona, which used to be called Southwest. And I got on this thing called the internet, and I didn't have my own laptop then. People didn't. I went to the library, signed up for my time, and I saw Bastyr, National, and Southwest, and I called, and they gave me their little swag package of like paper advertisements and stuff, and I read the Principles of Naturopathic Medicine, and those are incredible, but what lit my fire even harder was the therapeutic order. And the therapeutic order is the order in which you're supposed to break down, solve, resolve, and graduate chronic illness. And step 1 is remove obstacle to cure. And that is find what's kicking the patient in the shins, causing the skin rash, causing the headache. And they have repackaged that as identify and treat the underlying causes. And I think we're in a crisis, both in functional medicine, integrated medicine, and conventional model, where we're doing drug for symptom or nutraceutical for symptom or modalities like everything from awesome cold plunging, which I also do, to IVs, to covers of supplements that didn't hit the mark. And we need to prioritize patients' time, money, and energy on validated, clinically validated human controls versus sick patient, labs and imaging, not fad labs. There's a lot of labs in the funk med space that are good marketing, bad science. And then there's good funk med labs and good conventional labs and good imaging that sort. And if we want to just use an easy one, like a 3D digital mammogram tells you Susie has a breast tumor, Jenny does not. Does it tell you if it's cancerous? No, but it gave you an answer, yes tumor, no tumor. Right? Then you have to biopsy that, and that says cancer cells, non-cancer cells. You need that same standard of objective data to break down chronic, complex mystery illness. So step 2 of the therapeutic order is reestablish healthy regimen. That's diet and lifestyle. There's a lot of great health coaches, our nutrition team. They do a great job at that. Step 3 is stimulate the vital force. That's things like acupuncture, cold plunging, the right homeopathic remedy to push the case along, qigong, tai chi, movement snacks, those kind of things, right? Step 4 is tonify systems. That's where targeted lab-derived supplements should come in. Maybe Vitex for a squirrely menstrual cycle or dysmenorrhea, right? Step 5 is correct structural integrity. I'm all about having a chiro or a DO or naturopath who does naturopathic manipulation, put a rib back in. But then we want to use things like foundation training, Egoscue's pain-free method, knees over toes guy to retrain your body so that you can hold the rib in and not create a codependent relationship, right? I think everyone should have a good chiro for maintenance if they need it, but especially for when something tweaks. And then number 6 is drugs and surgery. We're not anti-drugs and surgery. They should be your last resort, not your first resort. An example of that would be vitamin D turns on the enzyme that turns tryptophan in turkey into serotonin. Why am I giving you Prozac before I checked your vitamin D3 levels, right? I'm not anti-Prozac. It's a last resort that can be a bridge for major depression, but I want to make sure their apnea is fixed, their CIRS is treated, their blood sugar is balanced, their T3 is normal so that they can set the pace of making serotonin, their D3 is up. You also need vitamin B6 to turn 5-hydroxytryptophan into serotonin. Did you look into all that? And we're still struggling. I'm waiting for the patient that we do a deep dive on depression, do all that, and they need Prozac, right? It's more the other way, where they come in with Prozac as a Boulder County organic yuppie, and they go, prescription bad, I need to get off this. And the first thing I say is, what have you changed? What underlying causes of why depression have you changed to have a friendly taper off that Prozac, right? And if they just taper the Prozac, it's like jumping off a six-floor balcony onto a concrete parking lot, right? But if you fix the vitamin D3 and you go, holy sugar, you have raging apnea, right? And you also took 17 rounds of antibiotics, including Bill Davis's great job in Supergut, wiping out the Lactobacillus reuteri, which releases secretin, which makes oxytocin, your love hormone. You're not going to have any self-love or love for the world. When your gut biome's off, you're going to be anxious and depressed. You fix all that, and then you can go 40 milligrams Prozac to 20 to 10 to off with your prescribing physician. So we're always going to collaborate on that. That's their prescription, but I'm the underlying cause guy that's going to help their patient have a taper. And then they're going to get less phone calls. The patient's going to be happy, and they're going to get back to living. So that's kind of how I got here. And we were kicking butt with autoimmunity and depression and brain fog and fatigue. And then 2013, we had 16 inches of rainfall in a week in Boulder, Colorado, and we flooded hard. That is an annual rainfall. So we usually get 16 inches a year. We got it in a week. Wow. And Boulder has kind of a clay soil in a rock basin, so we're built like a bowl. And first it was fun. There was a little bit, the streets started turning into rivers and the college kids were doing wheelies on their bikes. And then all of a sudden it was like 16-inch rivers everywhere. The park next to me was full-blown Niagara Falls. It was weird waterfalls going over footbridges. And then poopy water came up, which is endotoxin, as you know. So everything got so flooded, the manholes burst open, and it was like Venice, Italy. It was like canals. And patients who were getting better with us relapsed. And then even more importantly, patients that weren't getting better with us, which was driving me crazy as a doctor who wants to help, were getting worse. And I said, maybe there's something to mold in a semi-arid desert, right? Because here it's like, oh, it got wet, it'll just dry out. Mm-hmm. No, dry rot is problematic. right? So at the time I had this really cool eclectic phlebotomist, Cheryl. But she always had something she needed to corner me and talk to me about, like EMFs and crystals and this, that, and the other. And she gave me Dr. Shoemaker's Mold Warriors. And because of my busy day, I just threw it on the back shelf, and I was like, mold schmold. And then I said to myself, there might be something in that book for me. And it was the end of the day, and I had a quiet moment, and I read the first 2 chapters. And I tell this story a lot on the podcast. I'm driving home, and my brain, the book is sitting right there as my passenger seat, and I just can't stop thinking about it. So I pull over to this random Starbucks. I get a peppermint tea. I remember it like yesterday. I get to chapter 3, which is all the biochemistry that Dr. Shoemaker figured out, and the original version of the biotoxin pathway. Unidentified bright objects, CIRS masquerading as MS, elevated MMP9, anticardiolipin antibody driving miscarriage from water-damaged buildings. The Amish woman who had 13 pregnancies, 9 miscarriages, and was misdiagnosed Lyme disease. It was the moldy barn that was driving her anticardiolipin antibody, IgM, that lost all those babies. That's the darkest part of this illness, is women can lose babies to moldy buildings, right? And that's super easy to look at. Anticardiolipin antibody, IgM, is what went up. And the next day I called Deb Wadner, Dr. Shoemaker's everything in his office, assistant, researcher, collator of data, receptionist, all of it, Genie processor, Deb Wadner. And I signed up for the Shoemaker Physician Training Program. And I've been getting yelled at by Dr. Shoemaker ever since. And it's been the ride of a lifetime. He is a dear friend. He is an incredible mentor. He has fulfilled his Hippocratic Oath 10 times over. He has trashed his own health with 80 to 100-hour work weeks for well over 25 years, figuring this out. So me and my family and my patient population knows not that you have CIRS, that you need to screen for it, that there's confirmatory labs, not urinary mycotoxins, and that there is a proven peer-reviewed published treatment protocol called the Shoemaker Protocol, which he wants to rename the CIRS Protocol, that I just published a medical paper on last year. You can put CIRS Protocol Dorninger. That is exactly what you do when you have CIRS. If your doctor says they do the Shoemaker Protocol, you just hand them that paper and you say, this is the Shoemaker Protocol. If you don't do this, I don't want your services, right? If you're confirmed CIRS, right? Mm-hmm. And I told people early, like, you are out of your mind. Urinary mycotoxins is a marker of exposure, not illness. So it's not diagnostic. Everybody has urinary mycotoxins. And then the urinary mycotoxin paper Dr. Shoemaker put together, 60 to 100% of healthy people, annoyingly healthy people, in over 2,700 of those people in 21 medical papers have urinary mycotoxins. So there's no such thing as an elevated urinary mycotoxin because no one can show a difference between healthy people's urinary mycotoxin levels and sick patient. So if a biomarker can't sort you is or you isn't, it's not a diagnostic. And with these chronic complex mystery illness, we need biomarkers that say yes, no. And we were talking about how many biomarkers are there for fibromyalgia? 0. How many are there for chronic fatigue syndrome? 0. Hey, doctor, I'm tired all the time. Yeah, I figured you out. You're tired all the time syndrome. Do you go home and tell your spouse what a great diagnostician you are? Right? You need to know why we are tired all the time. And CIRS needs to be on your differential diagnosis. But if you have a severe apnea, it can be just as hardcore on your fatigue as CIRS. And some patients have both. So that is kind of where we landed. So we constructed a clinic that's in earnest trying to solve, resolve, and graduate the chronically ill. And we need you. Like, we need you in our society. We need you in jobs. We need you as functional parents. We need you as functional kids who's going to pay into my Ponzi scheme of Social Security so I get my check someday, right? We need a healthier society, right? And if nothing else, to relieve the suffering. People are hurting. They're anxious, they're depressed, they're overwhelmed, they're tired. They can't even do a run anymore without sitting on the couch with leg cramps as a 23-year-old, who used to be a competitive swimmer. So we have to get CIRS into the zeitgeist and the diagnostic consciousness. And we have to get it out of, we have to get the real way to screen, diagnose, and treat into the funk and integrated models, because it's just this weird hodgepodge of feelings and clinical vibes rather than proving your work. And if you don't prove your work, you're threatening the patient's time, money, and energy, and they come to my clinic run out. We could have packaged their complex chronic mystery illness, but they spend $250,000 on a whole lot of this, that, and the other every day, right? So that's the long story shorter. And I really appreciate you asking that because I love my job. I love serving the chronically ill. It's tough some days. People come in agitated, grumpy, neuroinflamed, but they graduate at a very good clip. And when they don't with CIRS, it's because we're working on the building. It's not that complicated. It's housing. So that's a whole nother crisis.
Yeah. Well, thank you for sharing that. And as a patient, I want to thank you for all the work that you do in your practice, but also as a person who wasn't a patient before, thank you for everything that you're putting out on social media. You're active on Instagram. You have so many educational videos there. You have your own podcast where you're sharing this knowledge. You've created CIRSx. Do you want to talk about that?
Yeah. So I have been teaching. I was a teaching assistant at Bastyr. I was a teaching assistant in anatomy at CU Boulder. But then I taught at Naropa University, taught at Metro State, taught at Seven Bowls College of Nutrition, Bowman College. I've taught for Apex Energetics as a functional medicine educator. I've taught at Bastyr. In a boomerang, we're going to Sonoran to teach CIRS in August. And I just love to teach. I don't love social media because it's just in a busy day when you're tired, I want to give inspired education. But I realized I had to get an IG handle just to promote the truth, the data-driven truth, so that the chronically ill have a chance to find proven underlying cause diagnostics that can sort you is or you isn't, rather than go on wild goose chases, squander all your money, and then when you find out what you really have, be broke, tired, exhausted, stressed out, flirting with divorce, wanting to just shake your baby because you're so tired. We want to get those people data-driven hope. We want them to feel hope in their soul that there's actually doctors out there who are returning to step one of the therapeutic order, identify and treat the underlying causes. Do not give a supplement at your first visit. Give a lab order. That is an organized differential diagnosis. When someone has a headache, I have 100 reasons for a headache. Guess what we're going to check? All 100 reasons. Guess which I'm attached to? None, right? Watch being a healthcare narcissist where you think you know. You don't know. That's a hodgepodge food fight of physiology in front of you. That's suffering. They need sorting. So a differential diagnosis is where we're going to set up this, that, and the other. Then we're going to use validated diagnostics to say my guesses were right or wrong. I'm going to be totally humble about that, right? And I'm going to confirm or deny my thoughts. And for a headache, for 100 reasons, most people have 17 reasons adding up, and they have a multifactorial underlying cause headache, right? So it could be like a tooth abscess with CIRS, with apnea, with a rec gut biome, with a vitamin D of 18, with blood sugar dropping to 62 on a CGM. And they all combine to create this threshold of chronic headache that's not a tumor. So now they've been to 17 doctors and they still have chronic headaches, right? I want to get that out. So those are the things I try and preach on IG. It's just exposure, exposure, exposure. The only thing I'm trying to sell is the dream of changing healthcare from what you have to why you have, so that you have a chance at graduating, right? Our podcast is the Vitality Hour, and you know that I just try and bring guests that have poured into me. I stand on the shoulder of giants. I didn't know how to prevent heart attack or stroke in any real way before I met Bill Blanchett and understood calcium scoring, right? The John Banta episode on just thinking through a house on a deeper level, right? My two boys can do a better inspection than most inspectors because they've heard me talk blah, 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 and they're curious. Right? You don't just walk by a water damaged ceiling tile. You get on a ladder and you open it up. And, some of the best, like Bill Weber and just talks about flashlight and being thorough, building curious, right? So a home ecology is similar to a physiology, right? It's a living, breathing organism. And you need building curious inspectors, not just going through a little checklist. right? Go through your checklist. That's where it all starts. You got to organize your way through a home. But when you see something and you got a hunch, you got to follow through, right? So we have people like that in the Vitality Hour. And then CIRSx, we realized in 2013, Lori Rossi, who's one of the authors of Mold Illness, Surviving and Thriving, kicked off the first, it was called Mold Congress, where we brought environmental professionals and healthcare providers under one roof. We need to learn from them. They need to learn from us, right? So they don't need to be an expert at the healthcare medical part of CIRS. They need to understand the basics, right? They need to understand they shouldn't go into my patient's home reeking of cologne, right? They shouldn't go into my patient's home after they were just in a super water damaged building after Hurricane Katrina and then can cross-contaminate my patient's home, right? They should know that they need to be wearing PPE because we don't want them to get sick, right? And so on and so forth. So we've learned so much from John Banta and Bill Weber and Mike Schranz and Will Spates, rest in peace. Cindy Edwards, who's the other author on that. Brendan Apple and I have coordinated a lot with Mold Inspection Sciences, Yaron and Justin, who started MedViro off of medically important remediation, which is a course that I inspired Bill, Mike, Greg Weatherman, Cindy, and John Banta to write because I was burning out as a doctor because I couldn't get good remediation in there. So you can do everything right on the healthcare side, and if the remediation sucks, you don't get past step 1 of the Shoemaker Protocol, which is remove patient from biotoxin exposure. So that course has been available for about 3 years now, and a lot of remediation companies take it and then cherry pick it. MedViro, which is Justin and Yaron, they heard me preach on that, and they said, we're going to shift our remediation company to do S520, which is the IICRC standards for remediation. The Surviving Mold Consensus paper in 2020 lays out this is how you do it. And the medically important remediation course is the details. It's, I think, 14 hours with pictures and videos and all the physics, Brownian motion and laminar flow. And it's just physics. Right. And if you do those first principle physics, the patient's going to win. And then if the remediation gets done right, then the inspector gets celebrated. The health coach gets celebrated. The clinic gets celebrated. If I'm seeing someone for CIRS 3 years later and we've had 3 shoddy rounds of remediation, it kills everybody. You know, we're lifting our end of the board. We're doing our end right. So that is what CIRSx is about. It's about bringing those healthcare professionals, the health coach, the patient advocate, legal. We want those lawyers to know how to win because this is a real illness with well over 40 medical publications just for CIRS, thousands of papers on dampness and mold, right? But specifically CIRS. So that's what we've been up to, and it's slow, but there's a lot of micro wins. And I think Instagram, Biotoxin Lady, you, my channel, CIRS Group, Christian Navarre Torres, it's just some people putting out some very real data-driven narratives on this illness. And then there's a whole wasteland of things like spraying biocidal fog, antimicrobial fog. That's a huge no-no. Encapsulating things. Nope, naked wood should be able to live in a home and not grow microbial growth if the environment's right, even in Texas, right? So that's what we've been hammering because I just can't hold another hand of a mom who's out of dough because they did $200,000 on shoddy remediation, right? And she's got 4 kids. And they all need all the labs, right? They all need all the CIRS, and some of them need VIP to regrow a 12-year-old brain. That's literally showing atrophy. So that's kind of what all that's out. And thanks for letting me share that because I'm proud of CIRSx, and I'm proud of the people who show up, and I'm proud of the people who still allow civil discourse and challenge each other. I challenge people like Dr. Shoemaker did me. I just try and do it a little more politely. And then if you have a good idea, we're also into trying to fundraise, prove it. And if it proves out, then it's worth the chronically ill patient's time, money, and energy. But if it doesn't prove out, it's got to go. Right? So we're not out to get anybody. We just maintain loyalty to the patient. It's about them.
Yeah. Thank you. Thank you for everything that you're doing. And I think the conversations that are happening there and the opportunity to learn more about CIRS is, we wouldn't be here and knowing what we do now without that. So
Yeah.
thank you. I do want to get into now what is CIRS, because a
Yeah.
lot of my listeners, this might be their first exposure
Yeah.
to CIRS. They might not know what it is.
Absolutely.
And when you say things like VIP, they might have no idea what that means. So can you
Yeah.
just give us a very basic explanation of what is CIRS?
Yeah. So CIRS is Chronic Inflammatory Response Syndrome. And you are born with HLA, human leukocyte antigen, in plain English, immune response genetics to everything on this planet on chromosome 6 from your biological mom and your biological dad. So you inherit half from mom, half from dad. And those are genes that tell us how your immune system is going to respond to everything. So there's an HLA for celiac. It's called the HLA DQ2 and 8. There's an HLA for Hashimoto's. There's an HLA for your likelihood to get type 1 diabetes. There's an HLA for your likelihood to get rheumatoid arthritis. So it's weird when people like challenge HLA and CIRS. I'm like, every inflammatory illness has an HLA, right? The only ones we don't know yet are the ones that we haven't unraveled and studied. But all those that I just said are already well peer-reviewed and published in the medical literature, right? So when Dr. Shoemaker was first learning this, he started seeing that there was HLA that increased your statistical likelihood to go into chronic inflammatory responses. Your own immune system going like Arnold in The Predator, where he knows the camouflage beast is out there, but he can't get a clean shot. My night vision glasses aren't working. I don't have GPS coordinates. Where's my antibodies? I'll just pray and spray. That's CIRS. It's your immune system praying and spraying inflammatory cytokine bullets. So it knows something's out there, but it doesn't know how to accurately tag and assassinate it. In the best of military, we go, bad guys right here. We got intel. We take them out. We don't cause a whole war, right? There's no collateral damage. We didn't blow up a school or a farmer's market, et cetera. Mm-hmm. With CIRS, you're not doing that. You're just blasting. And in Dr. Shoemaker's close to 10,000 biotoxin ill, 95%, 9,500 out of 10,000 had HLA predisposition to get the illness. To put that into context, it's different between Asian American, African American, Caucasian. For rheumatoid arthritis, the HLA is somewhere in the 20 to 80%. So 95% genetic predisposition on an immune response gene is massive. Celiac is close to that. That's the only other thing that's like, you are highly likely. Hashimoto's is more like 79%. So if you were born onto this earth with an HLA for CIRS, that doesn't guarantee you have the illness. It guarantees the statistical likelihood you're more likely to get it when you get exposed to biotoxins. Bio means nature, toxin means toxin. So we're not talking about evil companies dumping mercury into clean Colorado rivers. We're talking about nature toxins, and that is seafood toxins like ciguatera and Pfiesteria. All Puerto Ricans and Chileans know about ciguatera. They say, hey, gringo, you seem nice. You tipped well last night. Don't eat that fish. There's a ciguatera outbreak in the reef right now. Chilean sea bass, notorious for ciguatera outbreaks. Algae blooms, cyanobacteria. If it looks like pea soup scum is on top of your lake, that is not a healthy lake. And that aerosolizes. You don't have to paddleboard and take your motorboat. You can live near there. Elijah Stommel, MD, PhD, is showing the higher rates of ALS in regions around lakes with algae blooms. Water damage building. And on CIRSx.com, if you go under resources, you can go to old conferences and you can go to curated videos. Elijah Stommel was 2023 in Boulder when he did the keynote. He did that keynote, and my classmate Laurie Misha did the Parkinson's keynote on diet and lifestyle for Parkinson's. So it was a really neuro-heavy conference, but that's all there for free, right? We intentionally just want to pump the world with good data-driven truth, right? But if you have a lot of relatives with ALS and you're living around Lake Winnipesaukee in New Hampshire, that he is proving that there's a higher statistical rate of ALS around those algae bloom watersheds, which is crazy to be on the professional ride of a lifetime being like, holy cow, in my lifetime we could find out how to prevent, treat ALS before it just wipes you out, right? I've had 3 ALS patients in my 22 years and they're all dead within 18 months. So we have to move the data to seeing the illness before it shows up. And we've done that with Parkinson's and Genie. So it's really exciting times.
Wow.
Yeah. Then water damage building, mold, actinobacteria, which is a mold bacteria hybrid that likes the same climate as mold. It likes dampness. It likes high humidity. It likes things getting wet. And then sewer gas, endotoxin, kitty litter boxes, old Yeller taking a crap in the carpet over and over again, diaper pails, aging parents with dementia and depends, a manure pile right outside of your house with negative pressure where the outdoor air gets sucked into the inside of the house. You can positive pressure a house, so when I open the front door, the indoor air goes out. Lyme tick co-infection. I'm a Jersey boy who married a Mainer. Lyme is real. Co-infection is real. The testing is not. Bobby Kennedy just put a huge grant out for anyone who wants to validate their Lyme testing. We have one company in the funk med world who put their hat in the race, and that's Galaxy. And I give them credit for they are going to put their testing to the test. Everybody else, you need to sign up for that free grant money. And if you're not, I'm questioning why, right? So Lyme is real, co-infection is real. We are struggling with validated testing, right? Mm-hmm. And then recluse spider venom. Those are the,
really?
Yeah. And the epicenter of recluse is Oklahoma. So Texas gets plenty of recluse, and so does Colorado. They have a real ratty kind of spider web. Doesn't look like Charlotte's Web, looks all messy. And if you get bit by a recluse spider, you may need Keflex, the antibiotic, for the necrotizing lesion, but you also need cholestyramine Welchol to mop up the spider venom. Mm-hmm. Or you can just go totally neurological. Like your life changed when you got bit by that spider. If you have an HLA that doesn't clear biotoxin, you're going to stimulate chronic inflammatory responses to that recluse spider venom. So I've had like 2 or 3 spider cases in my 2013, 12 years of doing CIRS, wow. Right? But when it hits and it's just heroic. Like, oh my gosh, you just need cholestyramine to mop the venom out of your body, mm-hmm. right? And your body's trying to get rid of it, but it dumps it into your intestinal sewer. And without that garbage truck, cholestyramine, Welchol, colicevolem, the natural binders do not work. I'm the naturopath telling you this. Zeolite doesn't work. It's the exact opposite organic chemistry you need. It's good for mercury, but not for biotoxins. Bentonite clay doesn't. Charcoal doesn't. Okra and beet can work in really high doses for really long periods. So if you want to wait 10 years to heal, great. If you want to heal in 3 to 6 months, take the prescriptive binder. So that's a miracle medicine that Dr. Shoemaker discovered. So
I'm going to repeat back to you what you shared to make sure that I'm understanding correctly and that the listeners are following as well. So there's a percentage of the population that has this HLA gene that makes them that 95% of the time will make them.
95% of the CIRS patients have the gene.
Okay.
So let me clear that up real quick.
Yeah,
so the 500 who didn't have the gene,
mm-hmm.
in Dr. Shoemaker's data sets, they were in some of the most egregiously moldy places, like hardcore water damage building, but they didn't have the gene. Just like not everyone who gets celiac has the gene, but the majority do.
Okay, thank you for clarifying
so you
that.
can, and when people don't understand CIRS, I say, you can be there with the celiac gene. You've eaten gluten 400 times. Are you having an autoimmune destruction of your intestinal lining yet? No. So then one day you're eating gluten, you get the flu. And that's the final priming event that turns on an autoimmune attack to destroy your intestinal lining. It's the same thing with CIRS. You have the gene 95% of the time. You have the exposure. You went to a moldy kindergarten, then you went to a youth group, a church, and a moldy damp basement, which they all are. Then you went and played hoops in a moldy tournament, and you're relatively fine. Then one day you get mono, or you get COVID, or you get strep, or you get cold or a flu, and then you wake up dormant genes that were never turned on, manufacturing exaggerated inflammatory widgets, and they just start overproducing inflammation.
Yes.
That damages the motherboard in your brain called the hypothalamus. The hypothalamus controls temperature, it controls emotions and endorphins, it controls blood sugar, it controls blood pressure, it controls reproductive system for females and males. It can crash your testosterone and your androgens. It controls circadian rhythm, so you used to sleep deep, and now you don't. And that crashes a hormone that regulates the whole system called melanocyte-stimulating hormone. And now you have multi-symptom, multi-system illness. So think about everything I just said: blood sugar problems, POTS, anxiety, depression, OCD, bipolar and schizophrenia on the worst days, leaky gut, bedwetting kids, skin rashes, autoimmune looking phenomenon that sometimes have ANAs pop in and out on there. All of those downstream symptoms are going to be on a questionnaire that you ask a CIRS patient, right? Mm-hmm. And that's why it's called multi-system, multi-symptom illness. Many symptoms and many systems, but one origin, right? Exposure triggering your own immune responses to go bat bleep crazy.
Okay.
So anyway,
thank you.
Yeah, but you don't have to have the HLA to have the illness.
Okay.
The vast majority, 95%, have HLA. And our clinic is more like 98%.
The vast majority of people experiencing
of active CIRS people.
Yes,
That's
have
right.
the HLA.
That's right.
But only like 25% of the population has this HLA gene for CIRS?
Yeah, about a quarter of the population has HLA. I think we need to do larger data sets that include more African American, more Latino American, more Asian American. The data sets predominantly Caucasian. And we need a boatload of funding to take it to the next level. All that being said, the funding will get us there quicker. It'll help us publish large-scale papers that can affect standard of care in healthcare, and it can help us affect public policy for construction practices. Every patient on this podcast needs to hear that if you have chronic complex mystery illness, you need to screen for CIRS. That is any of the good coaches or doctor's office asking 37 symptoms arranged into 13 groups called clusters. And if you say yes to one symptom in a group of symptoms, a cluster, and you get to 8 out of 13 clusters, that's a 95% sensitivity, a 1 in 20 chance we're wrong that we're looking at CIRS. For kids, it's 6 out of 13 or more. And the definition of kids for that is under the age of 11. Then you do a visual contrast test. BeyondMold.com, Dr. Heyman's site, and Surviving Mold are the two places you can do it online. It's about $20, and you look at these blurred lines to see if your visual contrast is working. This is visual acuity. This is my reading glasses, right? Visual contrast is the ability to see blurred lines. There's 7 kinds of vision, and the visual contrast gets thrown off in 50, 80%, or 92% of CIRS patients. Shoemaker was 92% fail, McMahon was 80% fail, DiTullio was 50% fail. Only 1 out of 20 healthy people fail the BCS, so it's a 5% fail in healthy people. That is your screening. That just costs you $20 and 7 minutes of a provider's time, right? Mm-hmm. If you fail the VCS, is a 98.85% with a failed cluster symptoms that you're CIRS. So now we're 1 in 50 chance we're wrong.
Wow.
Then we go to the confirmatory labs, of which failed VCS is one of those. HLA, MMP9, C4A from National Jewish only. If you can't get C4A from any place but LabCorp, don't spend your money on it. LabCorp runs it differently than Dr. Shoemaker did the research. I love LabCorp. We use them for all this stuff, but we don't use them for C4A because they add futhan, a preservative, to the blood draw, which is not how Dr. Shoemaker did it. If you're going to do science, you need to repeat the way the original medical literature was published, right? Transforming growth factor beta, that is the only marker that we can no longer ever get the way Dr. Shoemaker got it 25 years ago. They bought new centrifuge machines. We still run it, but you take the new number and divide it by 3 as an approximate to get less than 2,382. We're working on funding that. That's a fudgy number there. Mm-hmm. Alpha melanocyte stimulating hormone only from LabCorp. ACTH cortisol mismatch, antidiuretic hormone, anti-peeing hormone, osmolality mismatch. That's why the kids wet the bed, is they lose their anti-peeing hormone. Gliadin antibodies and vascular endothelial growth factor plasma. Serum sucks. So it's not VEGF serum, it's VEGF plasma. If you're 4 out of 10 of those, you are confirmed CIRS. Getting close to p-values, the statistical chance for happenstance, right? Like coincidence, you start getting into the 1 in a million.
Okay.
So 5 out of 10 is what's published. So if someone's going into a court case, which I don't do legal, don't call me for that. I see 60 hours of patient care a week. I don't have any time for that. Dr. Oseni, Lysander Jim, April Fathulik, Ming Dooley, those are 4 people doing legal. And they know the illness to present the case in court. But if they have 5 out of 10 of those biomarkers are in very good shape, and then as you just get higher and higher, 7 out of 10, 8 out of 10, you just start getting close to 1 in a billion chance you're wrong. And then you move to the CIRS/Shoemaker Protocol, which is the only proven peer-reviewed published way to get out of this illness. Right? So that's big picture.
Thank you. Thank you. There are so many people reaching out who don't know how to get a diagnosis. And for a lot of these people, they have brain fog and they might not have been able to follow what you said. So again, I'm going to try to repeat it back to you. It sounds like as a first step, your provider should be giving you this questionnaire with symptoms in clusters.
Yes.
And you should be responding to those clusters. The symptoms are in the clusters, right?
Yeah. The clustered symptoms is 37 symptoms arranged into 13 groups, and you call a group a cluster. And that's a way in science where you can take subjective symptoms like headache or fatigue and turn it into an objective analysis to act as a screening.
Perfect.
Yep.
So they should be doing the cluster symptom screening and the vision test.
Visual contrast sensitivity test.
And those things, that seems really accessible. That's, you said only like $20 and one's online.
So many people come in and they spend $400 to $700 on urinary mycotoxin, which is a test for exposure, not diagnosis. You can't diagnose anything on that because healthy people have urinary mycotoxin too. It does tell you ate a moldy blueberry or you're in a moldy building. It doesn't tell you illness or not illness. And that's my whole point is people go in and go, CIRS is so expensive. Not if you start with us. Unless you have a major remediation, which I don't have control over, right? But it should be about 7 to 10K to totally break through with a provider and all the labs, and that doesn't include compounding and the remediation. But people come in here and they spent $250,000 and gotten nowhere.
Yeah, and just to be clear, what you're saying about the urinary mycotoxins is so important because there are tons of functional providers out there who are doing a urinary mycotoxin panel to prove to the patient that they have elevated mycotoxins in their urine.
Don't use the word elevated.
But
healthy
what you're
people
saying
have
is
the same level.
Exactly.
So
but
where
the
are you getting
providers
elevated?
are saying this.
I know.
Right.
Yeah.
Okay. So
that's the whole point. If there was an elevated mold illness person versus a knowingly healthy person. But what I'm saying is an NCAA wrestler who just wrestled for 5 hours and he or she won nationals, they have the same level of urinary mycotoxins as a super sick person who is bedbound.
Yeah. So urinary mycotoxin is not a test that's showing us any data because we don't have a control.
Nor is blood antibodies.
Okay. Helpful.
And that's because antibodies are the humoral immune system, the antibody producing. That is not chronic inflammatory response syndrome. The inflammation cytokines in CIRS aren't antibodies. They're bullets called MMP9, C4A, TGF-beta that just fire out nonsensically, right? Now, there are hardcore antibody diseases like Hashimoto's, which is an autoantibody disease that you overproduce antibodies to the thyroid, right? This is not. This is the innate immune system where it's just, right? So keep going because you're killing it. But that's the screening. And that's where you got the punchline for your listeners, right? Here's the punchline. If you've been to 17 doctors and you have complex chronic mystery illness and no one has done a clustered symptoms and a visual contrast sensitivity on you for $20 plus about 7 to 15 minutes of provider time, you can get to a 95 to 98.85% sensitivity, right? Not confirming, but you're in a 1 to 20 to 1 in 50 chance for wrong that you're not CIRS. And that also makes you feel confident I should unlock spending my money on the Shoemaker confirmatory blood draw labs, right? Period, right? When you do a clustered symptoms, there's an art form to it. Dr. Shoemaker always said you're cross-examining the patient with love, of course, right? I'm getting my lactobacillus reuteri back up. My oxytocin's here for the patient, right? So you're going to say, do you ever get confusion? And they're going to say no. Why are they saying no? Because they're thinking about their demented grandma in poopy diapers who has HLA and CIRS and was left untreated and is now in memory care. So then you have to cross-examine and say, do you ever walk into a room and forget why you walked in there? And what do they say? All the time. That's confusion. Confusion isn't sitting in poopy diapers in memory care. It's my brain doesn't work. I should walk into that room and say, I usually hang my hoodie at the front door, but then I went up and said hi to my son Ozzy. He and I started hooping. I got hot. I took off my hoodie. I put it on his bedspread. I'm going to walk into the room. I'm going to see my red hoodie on his black bedspread, right? And that's called spatial memory, right? That's confusion, right? So sometimes you ask weakness. Sometimes someone who is a hardcore CrossFitter who's dealing with CIRS and now has exercise intolerance doesn't want to say yes to weakness. They're grieving the loss of one of the biggest joys, movement with their crew, sweating, popping endorphins, PRing, wearing a weight vest for the Murph workout on Memorial Day. And now they have to say yes to weakness. So sometimes I have to ask him, you're 36, is your deadlift less than it was a year ago, right? And sometimes weakness is relative. Other times it's like, I can't sometimes say, how do you do with opening a jar? Mm-hmm. Right. So the questions are meant to be bing, bang, boom, but sometimes you have to get the patient into a place of trust and non-judgment where they can just tell you, hey man, this is our 4 walls of safety. We're here for one thing, restoring your health. Right. So there's an art form to doing the cluster symptoms, but it's meant to be very fatigue, yes or no, weakness, yes or no, static shocks, confusion, frequent urination, yada, yada, yada.
Yeah. So that makes sense. I mean, sometimes when you've been sick for so long, you forget what normal is like.
That's
so
right.
those questionnaires are so important.
Thank you that's the other, you just brought up a critical point where people normalize their symptoms. Right. And we joke the most about skin sensitivity because someone will have a psoriasis plaque lesion on their forehead right in front of my eyes. And I'll say, do you get skin sensitivity? And they'll say, no. And I'm like, brah, you have a psoriasis plaque on your forehead.
Yeah.
Right. Which goes away with treatment. Right. But they're so used to having plaque psoriasis.
Yeah.
They've had it for 15 years, 17 years. They don't even think that that's a skin sensitivity.
Yeah. So people who have CIRS, let's say now that they've done this screening, everything's looking very likely like they are a CIRS patient. They find a provider who follows the Shoemaker Protocol to a T, and they're really confident about this protocol. My understanding is that the person who has CIRS, they could go through all sorts of other protocols for other things and maybe make a little progress here and there. But if you have CIRS, you have this HLA gene likely, then you are not going to actually improve until you do the Shoemaker Protocol.
That is a loaded question.
Okay.
And what I would say is there's something I call the functional medicine hook. And I do a ton of functional medicine. I teach functional medicine. But if you have a high MMP9 that's getting triggered by mold exposure, fish oil helps bring that down, right? Mm-hmm. Doxycycline will help bring that down. Mm-hmm. Take doxycycline, your MMP9 goes down. You're like, I must have had Lyme. Right? How do you know that without a good diagnostic for Lyme? Doxy also lowers MMP9, right? Glutathione, vitamin D3 lowers transforming growth factor beta. So I love that functional medicine can relieve suffering, right? Mm-hmm. But do you have to be on $500 supplements a month to maintain a C plus B minus? Or do you want a curative protocol ... until your next major exposure? Meaning Dr. Shoemaker, through the sequential activation of innate immune elements clinical trial, showed the Shoemaker protocol totally normalizes CIRS patients until their next exposure. And then patients will be like all victimized by that. We're like, it's not cured. I can't go through Denver airport. It's totally cured until your next major exposure. So you just learned that you don't have to live in a dungeon with fear for the rest of your life, but you have to live a CIRS lifestyle where we're going to teach you how to find new construction hotels, and we're going to create communities where patients share like, hey, I did really well in this 2023 San Diego hotel. We had a great graduation for my CIRS daughter there. Hey, there's this new jiu-jitsu gym that is really clean. It's in a new building suite that I feel really good at. So it's a lifestyle. right? And people need a gym or jiu-jitsu. They need nature. They need a coffee shop. We're working on helping churches. Aeroasis just donated filters for this cutest couple I get to see in Fort Collins, whose pastor said, we want to really remediate this. Teach us how to do it. And they said, if you do that, we have 10 other couples with CIRS who would love to come to your church.
Yeah.
So these people lose their spiritual communities. They lose their gym and movement communities. They lose dropping their kids off at their grandmother's for free care because grandma's house is a mess, right? So it's super tough, but you slow it down and you do it right. My first time working with you, so it's your last time. Because I know if you're walking through my door, most people have seen 10 plus doctors. I saw someone the other day, it was 52 doctors before they saw us. We were totally solving this case, right? And then they usually also saw 3 environmental professionals, 2 or 3 remediations, right? And that's what MedVira was born out of, is the intention of MedVira is I can refer to them and I don't even have to look over my shoulder. They are doing medically important remediation. They're doing medical grade from the start. They're not pretending. There's oversight. There's higher ups for complex building scenarios, just like I'm going to call a mentor for a weird cardiac phenomenon, right? So we're trying to create an ecosystem where your first time through this illness, you win.
So this brings up a really important question that I actually got from one of my listeners related to remediation and going through the protocol. Her question was, how do you determine whether your ongoing symptoms are from a continued exposure versus internal dysregulation and toxin buildup? So this person, I know she's on one of the binders. It's not clocetylamine. I think it's chloroscylamine.
Cholestyramine.
That one. Yeah. And she's gone through remediation. She's gone through another remediation. Yeah. And so many of us are kind of gaslit about the nervous system. So how do you determine whether you just have a lot of healing that you need to do and you have more protocol ahead of you?
Yeah.
Versus it's still your environment.
Yeah. So this is a super loaded question that I want to take a minute to talk about, right? So first of all, this isn't promoting. I wrote that medical paper for 2 people. It's if you put CIRS Protocol Dorninger, it'll come up. It's free. The first is an homage to Dr. Shoemaker to say, brother, me and my family are still sick without you. You are the man. Thank you for yelling at me and demanding excellence. As a doctor, I'm not traumatized by that. I invite it. Call me out on my bullshit, right? I'm loyal to one person, the patient. I need to keep bringing them a better and better doctoring version of me, right? The other person I wrote that paper for is the patient. They need to read that paper. It's lay terms enough. If there's someone like you who's deep diving into CIRS, you're going to actually catch more than most doctors who've never been introduced to the illness on your first read, right? Any doctor can train up on this. They just need to be hungry, humble, vulnerable, and get ready to totally overhaul their practice or become a screener. So I tell doctors, you don't have to take my pain. I'm talking about buildings all day. You can become a screener or a screener and a treater, right? But don't dabble. Know that you screen or know that you do the whole enchilada, right? So that paper's there to take people through how to do all that. And it's basically the original environment relative moldiness index, which is based on mold-specific qPCR. The way they amplify DNA on Law & Order SVU to see who done it, MSQ-PCR amplifies the dust, the DNA of mold in your dust to see if you have water damage building molds. And the original ERMI score of less than 2 was statistically likely to heal from CIRS secondary to water damage building mold. Doesn't say anything about endotoxin or actinobacteria, but mold. Mm-hmm. There was too many false positives and false negatives off that. So Dr. Shoemaker made the health effects roster type species mycotoxins and inflammagens too, also known in his funny ass humor once you surrender to his gruffness, the hurts me too. And CIRSx has shirts that says it hurts me too. And it's an homage to the, part of healing trauma is humor. And it's an homage to the patient suffering, to Dr. Shoemaker's humor, but it does hurts me too when you have a hurts me too of greater than 10. So if you're less than 10, that is the only published testing on the planet that shows the clinical correlation of the statistical likelihood a patient will heal in a building from CIRS water damage building mold. So what I just said is, You can do an air sample of my wall cavity here and see if I have mold in there. But if I do, you don't know what level it needs to be for me to be statistically likely to heal. I can say, is that schmutz or mold, and do a swab, and that's great for identification. But there's no swab sample level that's shown statistically likely to heal. So it's just a hurts me too is the only way to show statistical likelihood you will heal in a water damaged building from mold. For actinobacteria, there's 2 pathogenic bacteria on the actino index, and that's Corynebacterium tuberculostericum, the one that looks like tuberculosis but is not. We call it CT, so I don't have to write it over and over again. That should be less than 10,000 in the building. And then PA, or Propionibacterium acnes, and that also makes acne on your skin. But those first got their start in water damaged buildings, and then they can colonize humans. But in the dust, it's supposed to be less than 10,000, both. And then there's endotoxin, which picks up gram-negative bacterial lipopolysaccharides, which can come from sewer gas, poop, caca, doo-doo, manure, but it can also come from like a weird orange jello growing in your pan underneath your HVAC. That's a non-poopy gram-negative bacteria. So it just says it's gram-negative bacterial lipopolysaccharides. And if that's less than 100, you're statistically likely to heal. But for your listeners, if they have cortical gray atrophy on a neuroquant, or they have endotoxin showing up on a Genie, regardless of what that says, I have changed my algorithm to mandatory Plumber smoke test. Right. And there's,
Sorry, go ahead.
Oh, and there's 2 guys, Clear Home Biotesting, which is Adam Moran's, and Seth Tanner. He's our guy here, Colorado, and Seth Tanner out of Arizona, that I've coached on doing $195 consulting fee for. If you find a plumber who's willing to do a plumber smoke test, but they're not totally dialed, you can pay them to talk to your plumber. Right.
Oh, great.
And they were doing that for free. And then, like, you know how it is in marriage. If you're like talking to people all the time for free, your spouse gets pissed. They're like, come hang out with me or make some money.
Yeah.
So I said, look, guys, I need you to consult with these plumbers all over the country. And it's a way we're trying to standardize that.
Oh, that's
because
fantastic.
There's a total art form to the plumber smoke test. And for your listeners, that's where you put non-toxic theater gas in the sewer main, and you're looking for pinhole leaks in your plumbing. You'll see a toilet start to smoke and the wax ring is busted. One of Genevieve's patients, the mom was getting headaches upstairs, did a plumber smoke test, the wall started smoking.
Oh my gosh.
Sent over remediation, opened up the wall, a poop pipe plumbed to nowhere, fecal wax, like an old dorm candle, all over the insulation. Yeah. Oh, like gross. Yeah. So basically they were probably going to put an addition on with a bathroom. Someone just forgot to put a cap on a poop pipe, and it just gurgles with steamy doo-doo.
Yeah, but for people listening, like, that's not just gross. That's actually prolonged exposure to a biotoxin that's causing you CIRS.
100%. And it's actually average American house, which is like, makes me want to vomit, right? My dad's native Austrian, and, you know, my cousin Werner does tile in Austria. He didn't do that tile for you. He did it for him. It's his Picasso that he's gifting you with pride. We don't have that in American construction practices, right? My other cousin is the town drunk. He's the village drunk. Everyone knows, don't let him in your house. He's going to screw something up, right? Everyone wants Werner. And that's what I try and bring to my healthcare. I want to be proud of what I do for these people. They're broken. They're exhausted. They're flirting with daydreaming all day of, if I wasn't married to this person, my life would be great, and fantasizing and daydreaming instead of just getting down and dirty and understanding the why my brain doesn't work, understanding why my skin rash, understanding why my fatigue and my exercise intolerance. Then if you want to reevaluate your marriage with a clear brain and a clear heart and waking up rested, go for it, right? But it's the same thing with counseling and therapy and trauma. I love all of those. And I want you to be doing that work with the most intact brain so you can integrate the work and not stay in these low dopamine inability to finish tasks where you can never resolve grief, right? So there's one other thing on the nervous system stuff. There's a trauma gene on the Genie panel. It's called the
FKBP5,
FKBP5.
right? Okay.
It made it on the Genie because Dr. Shoemaker had 70 annoyingly healthy people's genies, and then he had hundreds of CIRS patients' genies.
Can you clarify what a Genie is for someone who doesn't know?
Thank you. So Genie stands for genetic expression, inflammation explained. The N doesn't say everything. And you rub the Genie bottle and you get all these answers about your physiology. So I don't care if you have MTHFR as much as if you're not clearing homocysteine in the methylation pathway. I don't care as much as if you have the HLA for CIRS as much as if you're making MMP9 TGF beta C4a and you've turned on the expression of that gene. So genes just sit dormant and then they turn on and off. And when they turn on and off, they make proteins or they stop making proteins. And some of those proteins are good, like amylase, protease, lipase to digest in my pancreas. Some of those proteins are problematic, like MMP9, where I'm just firing out chronic inflammation. Genie, and that's called transcriptomics, and that's the future of medicine. Not if you have a gene, but if the gene is turned on for better or worse or turned off for better or worse. There's a gene on Genie called ATP synthase that makes the enzyme ATP synthase that synthesizes ATP, chi, prana, life force. We want that thing turned on. It's turned off in CIRS cases all the time. Right?
Okay, so that would mean like having a CIRS diagnosis, meeting the criteria would affect your mitochondria.
100%.
Okay.
Yes. And then we're over here in funk medicine going, you have mitochondrial dysfunction. And then we're making fun of conventional model for calling it chronic fatigue syndrome, right?
Yeah.
Sir, kind madam, why are my mitochondrial dysfunction? Is why I'm paying you, right? Mm-hmm. And what happens with biotoxins is they clog the tunnel to get ketones or glucose into the mitochondrial fire pit. It's literally like an avalanche of biotoxin rubble that covers that tunnel. And then you get stuck making energy outside the mitochondrial fire pit. And for the same glucose log, you only make 8 units of ATP plus lactic acid, and that's part of what gives you the heavy leg and the extra intolerance. When you can get that ketone or glucose into the mitochondrial fire pit, you make 33 to 35 net ATP, 4x the energy, with no lactic acid buildup.
Wow.
And that's why when you get people in clean building on cholestyramine, the cholestyramine starts to excavate the biotoxin rubble. It's called the voltage-dependent anion channel. That tunnel opens up and traffic starts rolling through the glucose logs, start getting in the mitochondrial fire pit, and you go, I feel a little bit better. Mm-hmm. I'm thinking a little more clearly. Yeah. I went for a walk and didn't drool all day watching Netflix, right? I think I'm going to stop dating Netflix and start pursuing humans, right? And so on and so forth. So that FKBP5 gene made it on the Genie because it was statistically higher in the CIRS patients than in the healthy controls. And the FKBP5 gene is a gene that turns on the production of inflammation from trauma. Mm-hmm. So there's 2 things that changed my experience with trauma as a doctor. One is you can get brain atrophy from trauma, and the other is that you turn on a gene that produces inflammation. So what I just said is Tommy could call me ugly on Facebook 20 years ago, and I still have joint pain today from that, right? We have 7 cases of pre and post DNRS, Gupta, and Joe Dispenza's work that turned off the FKBP5 gene.
Absolutely incredible. I want you to say that again. These programs that people are doing, whether it's Joe Dispenza, DNRS, these brain retraining,
I got to give out
system.
a shout to Primal Trust because a lot of people love that one too, and it's packaged nicely in regards to time and effort and doing a lot of kind of qigong, get in the body type stuff, right? We just haven't had a chance to pre and post test Primal Trust, but you can extrapolate. It probably works, but I'm a scientist, so I'm going to just say they're all great. However, that work doesn't turn off endotoxin genes.
But what you're saying is that work is turning off a gene that is triggered by trauma, and that trauma
that produces
gene
inflammation.
That's
crazy.
Remarkable.
It's remarkable.
That's really, really remarkable.
Yes. Now here's where we get in trouble, where people over celebrate those programs to treat CIRS. And
so it's a different gene though, right?
Yes, it's different genes. So, and here's where we get in trouble. People say the CIRS Shoemaker Protocol is going to treat the trauma gene. It doesn't.
This is why so many CIRS practitioners say that, or I guess functional practitioners too, say that the nervous system is a huge component that you can't
Yes.
ignore. Because I would imagine if you go through your whole
No,
Shoemaker
the nervous system is
protocol-
not a system you can't ignore. The nervous system is a part of your patient in front of you that you have to understand. So if I have a triathlete who just did the Ironman, the Iron Woman, and then they get CIRS, a lot of them don't need trauma work. They need bing, bang, boom.
Yeah.
Get me the protocol. I'm getting back to running. I've had agency my whole life. I am not about trauma. Get the F out of my way. I produce. There's that kind of style patient. Then there's a patient who had Uncle Creepy and has CSA, child sexual abuse, and they're going into a water damaged building with predated trauma, and they have so much healing to do around that deep violation. And this is what I'm saying. Don't project everyone needs nervous system work. But the people who do, it is an underlying cause that has to be addressed. And that's healthcare narcissism. I'm a therapist, so therapy is the greatest. I'm a da-da-da, so da-da-da. I'm a Wim Hof breathing coach. So they're all great modalities, but the art of science with now transcriptomic data can help you sort out. And the reason that's so important is because it's gone the other way where someone didn't need the trauma work so much. And initially, the initial DNRS programs were an hour a day. That's a lot of time when we're also asking you to meal plan and balance your blood sugar and find an inspector and a remediator. One of the things I loved about Primal Trust is that they consolidated the time, and it was stressing people out to do the hour. Right. So again, it's the trauma work is real. The FKBP5 gene is real. It's probably one of many trauma genes we're going to discover. The brain atrophy is real, but you have to understand your patient in front of you. I'm going to tell you one other fascinating thing that's total clinical anecdote, but I've run hundreds of genies. Trauma doesn't titrate. So if someone's been raped 3 times, that doesn't mean their FKBP5 gene is guaranteed to be turned on. It doesn't titrate. Sometimes it's just someone can be in an emotional snickety marriage and they have a critical spouse that's just been picking and picking and picking for decades. And that'll turn on the trauma gene. 3 categories of people in my clinical observation. Kind of what I would call blue-collar Christians, hand and feet Jesus, people who are really into service and community, true meditators, people who meditate very consistently, and people with deep communities have come in with lots of trauma and that gene isn't turned on. And I expect it to. And I think there's 3 things there. I think meditation is a parasympathetic regulation program. When people do it for years, it's almost like people who do short form yang style Tai Chi 7 minutes a day for like 40 years, or they've been doing Qigong forever, right? I think if you have true faith, which is trust in something higher than you, you're less likely to get victimized by a rape trauma, or it doesn't define you, right? It happened and it needs processing, but it doesn't define you. You have a bigger perspective on life. And then I think community is such a huge deal because my classmate, Lori Mishley, who did the Parkinsons talk on Boulder 2023 CIRSx, she's tracking 3,000 Parkinson's patients for diet and lifestyle. We're finding the underlying causes of Parkinson's, but she's saying what works for diet and lifestyle. And she's following gluten-free helps, dairy-free helps. 3,000 patients are loading up everything they do, right? Chicken bad, turkey good. She's just totally detached as to why. It's just, this is what works. Have a glass of wine, good. We don't know if red is better than white. The number one predictor of Parkinson's progression in diet and lifestyle aspects is loneliness. Loneliness is inflammatory. So I think it's very interesting that these people who have like their CrossFit gym or their yoga crew or their church crew or their high school buddies who still go to Nuggets games together, right? These people are doing better with traumatic events.
And I think when you have CIRS, whether you know that you have CIRS or not, it can be very isolating. The reason I started my podcast was so that people felt less alone with chronic illness. Because when I was going through it, I was so tired, so fatigued, I didn't have the energy to talk to anybody.
That's it.
So I think it makes so much sense why these genes might get flipped on, even if you haven't had something horrible happen to you that you can recall. If you haven't had one specific event, sometimes just going through chronic illness can be traumatic.
100%. And, I shout out the coaches that do great groups. Jenny Johnson, Lauren Lowenstein, JC and Barbara, the CIRS group, Kendra Betts. She runs a Christian group, but it's open to everybody. The gifts of those groups are you walk into the group visit on a Zoom and you don't need to explain your story to anybody. Everyone understands the C in CIRS is as potent as the C in cancer, right? Everyone gets it, right? Whereas like other times you're like, what's my elevator speech to explain this illness to my uncle who doesn't understand why I can't come to his moldy cabin at Grand Lake for July 4th, and it's like, this is the pressure you feel all the time, right? Because I don't want to put people out. I'm not like, I'm not going to your July 4th. Your cabin is so moldy. Like what I might do is I might roll up, pee or poop before I get there, do some Wim Hof breathing and hold my breath if I have to use their crapper, right? Enjoy the barbecue outside, and just not create waves that I'm not going to fix, right? Choose your battles, choose your buildings, right? But I love this time of year because this is where CIRS patients can get out on patios and decks and barbecues and just get back to community. Right. So I'm glad you brought the trauma piece in, but read your patient, read your client and understand, do you need a little bit? And sometimes you have people who can't even process the trauma until their blood sugar is steady. Right. Apnea drives the same exact pathways of sympathetic overdrive, cortisol spiking, norepinephrine, epinephrine, as molestation or emotional abuse. Wow. Now it's you're not having a knife to your throat, but you're literally going all day and you're going to have the same physiological response because your brain still thinks it's dying. So there's also physiological causes of trauma.
Yeah.
Right?
Yeah, absolutely.
So it's like getting choked by a mugger is the same physiological experience as getting choked by apnea, right? It's just, it also is attached with a creepy person, right?
I'd be so curious to see what the correlation would be between that trauma gene and hypermobility.
Oh, that is, we have my medical research assistant, Kristen Voorhees. She's really bringing us together with everyone doing EDS. Dr. Hepworth, Anschutz has a program, blood patching. Centeno's doing craniocervical instability stuff. There's an intersect between those, and it was the 11352B HLA from Dr. Shoemaker. They have more hypermobility. They have longer arm span than height, so you can get a tape measure in clinic and measure them. They all fail the Beighton criteria of the 9 symptoms of bendy Wendy stuff.
Which I did.
Yeah, totally. Yeah. So how many illnesses fall under the umbrella of CIRS? And what I'm going to tell you is every single specialty, some of them. Some of your rheumatology patients are underlying cause CIRS. Some of your dermatology patients are underlying cause CIRS. Some of your psych patients are underlying cause CIRS. Some of your psych patients are concussing from football, right? So it's not everything is CIRS. It's that everything complex, inflammatory needs to have CIRS as a screening confirmatory labs. And then if it's there, you're stoked because there is a viable, proven, reproducible treatment plan called the Shoemaker Protocol or the CIRS Protocol. You're not stoked because it involves buildings.
Yeah, and to tie all of this back, that Shoemaker Protocol is flipping off the inflammatory gene.
That's right.
So, wow, okay.
Yeah, so Dr. McMahon calls it the 1-2 punch. Punch one, jab, is the remove patient from biotoxin exposure, right? If you don't want to get cancer and you're living next to Chernobyl, the first move is move away from Chernobyl, right? The second one is cholesevolem, Welchol, and cholestyramine, 3 versions of the same organic chemistry. is a garbage truck that comes through your intestinal sewer, goes out your butt, same way it went through your mouth, except it picks up the biotoxin in the bile that your liver, gallbladder, blue collar working so hard is trying to get to the toilet. But if you're not on that medicine, you reabsorb 95% of that bile, and those biotoxins stay in you and keep stimulating your innate immune responses, not your antibodies, not antibodies to mold on a test, not nothing to kill. You don't need diflucan or itraconazole or Sporanox or ketoconazole. There's nothing to kill. And when we use those medications inappropriately, we create drug-resistant Marcons. So that's totally irresponsible, and you're creating drug-resistant bugs that our kids won't have drugs for, right? It just picks it up and takes it to the toilet. And then MMP9, TGF-beta, C4A fall. And then with the brain MRI with NeuroQuant, you see if you have to regrow that brain or not. You're comparing your brain to healthy age-matched controls. Again, no data point matters unless you have, what does the healthy person in my age group's brain look like? And if you have more atrophy than them, the last step of the Shoemaker Protocol in the paper is called vasoactive intestinal peptide. It literally regrows brain, not on like muscle tests and being like, bro, your brain's better, on a third-party computer-read brain MRI with NeuroQuant. It's as objective as it gets. So we are regrowing brains at roots and branches. What I don't know is, should we be doing this with the NHL and the NFL? And you know, I'm a MMA freak, and I roll jits, and I like to see a head kick or see a good buff tackle. And then I have this guilty pleasure with that because I know that person might have leaky gut and be wrecked. Should we do VIP with TBI? We need funding.
I didn't even think about the other use cases. I'm so pigeonholed in my experience and all the people who reach out to me who have experiences so similar to me. But you're absolutely right. The use cases for this go so far beyond people with CIRS.
Not like a review article or other things I published. My first true medical paper was in 2024, where we showed some Parkinsons are due to CIRS, and they respond with improvements to the Shoemaker Protocol, right?
And community.
And community, for sure. And like loneliness is the number one real thing on diet and lifestyle for that population. And then that pattern of Parkinson's, called a triple positive, shows up before Parkinson's does. So we catch that pattern in a lot of our CIRS patients. We treat them with the Shoemaker Protocol. It turns off the triple positive Parkinson's. So we are now able to see the Parkinson's train before it pulls into the full shakes, anxiety, shuffling, demented train station, and say, I think we'll go another direction. And that's what I've always wanted. That's the deepest form, is let's just prevent diseases before they even happen. But to be able to say we can do that for some Parkinson's, that work needs refinement, but the spark is there.
There's so many practitioners who have asked why. I mean, not enough practitioners are asking why. A lot of practitioners, as you said at the beginning, are treating symptoms with medications and supplements and things like that. But there are so few practitioners who really ask why and then actually solve it. So again, I just want to thank you for the work you do. You are changing lives, saving lives in your practice and beyond, on behalf of everyone who gets to learn from the information that you share and the information from others that you're sharing as well. Thank you so much.
Thanks for the shout out, but I'm telling you, this is not my information. This is the people's information. So any doctor, any patient advocate, any coach, any healthcare provider that wants to learn this illness and do it for real, our door is wide open. Come hang out at CIRSx. Our pre-conference workshop that Dr. McMahon and I are doing are on complex cases within the CIRS. So there's levels. CIRS is a spectrum too. Like some people are like a C-, and you're going to get some people are bedbound, and we're getting them to a C+. So it ain't easy, but it's real, good, honest, true medicine. And we need an army of providers. We need an army of inspectors, of health coaches and remediators, lawyers, patient advocacy, and funding to take down this illness. This is eradicatable. And then we need to go after the real underlying cause, which is construction practices. So maybe we'll save that for another episode.
Absolutely. Yeah. Thank you so much for
Thanks
coming
for
on the
having me,
podcast.
Becca. I appreciate you.